Ready to go.
Okay, so this would be a complete shoulder treatment, not for any specific injury, but for the whole shoulder complex. But it will take into account shoulder dysfunctions. All right. Let's start by MOFA, warming between the shoulder blades, the rhomboid group, the upper trapezius. I have to remember the latissimus dorsi muscle here can also affect shoulder movement. So for this case, we're going to go for the right shoulder. I'm going to roll, keeping it between the shoulder blades on the muscle group. Already, only after a couple of minutes of MOFA, her shoulder blade has dropped. So just even the act of MOFA just relaxes the patient. They're preparing their own body for treatment. All the time I'm feeling underneath my knuckles, feeling, can I feel tension? Do I feel the muscle group hard? Is the tissue like underneath? Is it responding to the gumpha? Is it softening? Then to the upper trapezius group. Keeping the rhythm smooth and steady. It's not really softening, so I'm going to check the neck. And the neck is quite stiff too, so doing long tuifa, so a long movement as opposed to a short movement on the right underneath the occipital bone, going towards the spinous processes, so from the general transverse area covering the gallbladder and bladder meridians right towards the dupe. Waiting for that muscle group to soften. Working myself gently down, so I'm going down towards T1, C7, T1, but taking my time in doing that, not rushing it, not using a huge amount of pressure. I'm just trying to get the area to relax. Soften the tissues there. Squeezing, tuifa, grasping. And in some cases, because this area isn't soft enough for me, we need to just make sure the control mechanism, the brain stem, that area is good, is more compliant. Grasping and lifting. I'm not doing this with my then I come back to check, and that's much softer, much easier. You can feel the difference there, Janet?
Yeah.
Yeah. Then Tuifa. If a person is more stronger, physically stronger, more muscular, then I will use my elbow this way. If they're a lighter frame, I'll use 2 thumbs or 1 thumb, Tuifa, across the muscle fibers. So working from sort of T1, coming down to the acromion process, acromioclavicular, but not actually on the clavicular. You're at the back of the body, sort of coming to the top of the shoulder blade, if you like, and all that area softening out. If you're into the points, you'd be sort of Sanjal 17, gallbladder 21 region, Sanjal 15, sorry. Too far away from the spine this time, smoothing out the rhomboids. Next to the spinous processes, the Jaji. And Rogfa. Rhomboid group. And down the spine, you will feel other areas of tension. Like generally when there's a shoulder problem, you'll feel tension usually through the whole spine, all the way to the crest of the hips there. So be aware of that. The whole body will be affected from a shoulder injury. We had a young lad in yesterday who had fallen quite badly, and one shoulder was higher than the other. Too far. So this would be small intestine 9 and 10 region. Now if the person has difficulty in mobility, that is kind of abduction, moving the shoulder upwards and away from the body, work this area. If they have pain at the front of the shoulder here, work this area, yeah? Tuifa. Ija-chan. Points. And then locate small intestine 11, center of the shoulder blade pressing. Be careful, it can be extremely painful. And then grasping. Rolling. Growth. You can, of course, some people when they do Tuina are sneaky, and that as they're working this area, they're slowly pushing with the thigh, the shoulder up this way. So as the person's relaxing, they don't even realise that they're getting
I see.
a very good
Traction kind of.
yeah, kind of a mobilisation this way.
Okay.
But you know, you need to be really aware that to take your time if you're doing that particular technique. Then for the shoulder blade, if the person is able, some people are not able, they don't have the flexibility, is to open up behind the shoulder blade, hands behind the lower back, get them in a comfortable position, test with your fingers to see how much of a shoulder blade is on display. Can you actually get in behind there?
Mm-hmm.
Some people it's not possible. I drop my forearm into here, push down into the rib cage, and then I scoop by leaning towards the body and bringing my arm back. I open out the shoulder blade this way. You see?
Okay. Yeah.
And that opens out the joint. If the person is particularly tight at the front,
Mm-hmm.
I get my arm underneath the shoulder blade this way. Then I can use the two together to open.
Okay.
Then I'll get underneath. So I'll weave my hand underneath that space. I'll drop my weight, bring that elbow into my center, and then using my legs and my center, I'll mobilize the scapula. Many different rotations, directions, figure of 8, with bash and fast stretching. Using my natural body movement. That then, you can see the difference already
Yeah.
between where that shoulder blade is and this is now really opened out to the side. Yeah.
Yeah.
This area is softer, everything is softer. Then I will just give a general back routine. I would probably repeat, if the person has general shoulder issues, I would repeat on the other side too. But if my time is limited, I'll stay to the injured side. You can also apply diaphragm pressure to the jaji to help correct spinal structure, promote flow to the jaji points, relax the nervous system. Okay, and then I'll ask the person to turn over. Yeah, it's good, isn't it? Okay, so lie back. So remembering now which arm and shoulder we've been treating, there can be a mistake to go to the other side. So I would definitely, obviously, be careful with female bodies where you place your fingers and hands. I would, if I can, I would grasp underneath the elbow this way, relaxed fashion, using Tuina into the shoulder complex this way. So in line with the tendon, sorry, Janet, just to begin with. And soften everything.